Welcome to Brainstorm 9000.
You got a brain? Your brain wants to listen to this podcast.
So open your brain.
Oh, my series in French. You want to use your series?
Use it in French, it's fun. Right, okay, you start now.
Siri, quelle est psychologie?
There is no sound too.
Raise my volume here.
And it's a man for your case, in your case?
Yeah, that's
Okay.
what it defaulted to. I don't know. Siri, quelle est psychologie?
Voilà ce que j'ai trouvé.
What did he say?
He showed me ecology. Wish he's being annoying. That's how you say it, right? I'm not mispronouncing it?
In French?
Yeah.
Psychiatry or...
I was saying psychology.
Okay. Let's check. It's actually very easy. Just I can translate. So we'll translate it to French. We are going to end text. Psychiatry. Psychiatry. But let's see what it says. Okay. Listen.
Psychiatrie. Psychiatrie.
Psychiatry.
Siri, quelle est psychiatrie?
Voici ce que j'ai trouvé.
Gave me
No,
psychiatry.
No, psychiatry. You say psi, you say p. Psychiatry.
Ah. Siri, quelle est psychiatrie?
Voici quelques informations.
Oh.
What does he say?
So my fancy French man Siri
Right.
says, should I translate? Or
Yes.
Okay. So psychiatry is a medical specialty treating mental illness. The etymology, I'm trying to translate. You
Right.
guys got to bear with me. The etymology of the word is from the Greek psyche, which
Yes,
signifies the spirit or the soul.
Let me consult with our American series. So what Hermes did, we decided to open this episode with him asking his French-speaking Siri, who happens to have a male voice, right?
Mhm.
And basically is not very talkative and nice. Let
Mhm.
me see what our American Siri says. Hey, Siri.
I'm listening.
What is psychiatry?
Psychiatry is the medical specialty devoted to diagnosing, preventing, and treating mental disorders. Do you want me to keep reading?
No, thank you.
Of course.
Oh, she answered. Hey, Siri.
I'm here.
What is psychology?
Psychology is the science of behavior and mind. Psychology includes the study of conscious and unconscious phenomena, as well as feeling and thought. Want to hear more?
No, thank you. Okay.
So French Siri doesn't like to talk. American Siri wants to talk all
And it's a
day.
man, yes.
Yeah. Okay. Cool.
So, but what is the reason we decided to talk about this?
So, like, pretty much, one, people use this word psychiatry versus psychology a lot,
Right.
right? If I'm mentally sick person, you know what I mean? Like, I'm just crazy. I'm a
Right.
mad scientist, but I decided I need to get help.
Well, we shouldn't talk about it, but we are trying to hide it from you, Hermes. Okay? You are normal, okay?
I'm normal.
Yes. I'm going to count to 3 and snap my fingers, and you are going to go to sleep. 1, 2, 3. Well, he's not sleeping. All right, so keep talking.
I was hoping it actually happened.
No. All right, so keep going.
I don't need the 3 seconds to do the sleep though. You
No.
give me like 1 second
Okay.
naturally. I could have put
Okay.
myself to sleep.
Yeah. So your question is, what's the difference? Or
I'm
what
trying to
are-
reform my life as a mad scientist.
Right.
And I need to know, first off, what psychiatry and psychology even is.
Right.
And then how do I find a good one of those? Like, it's not like going to the doctor like, oh, my doctor like had me fixed up really good. I had the flu last season.
Right.
She got it out of me like in 2 weeks. Like,
Right.
how do you address that when it comes to like psychology?
Well, first of all, I have to tell you that if somebody is you said crazy, or what? How did you describe yourself?
I'm mad scientist.
Mad,
I don't like using
like
the
if
word
somebody
crazy.
is
Yeah.
mad or crazy or whatever people say on the street, meaning really, really, really sick mentally, they usually lack a capacity to observe themselves kind of from the outside,
Yeah.
and they never think that there's anything wrong with them. So if you met anybody who thinks that they are perfect, and you probably met people like that,
Yeah, no.
there is something wrong with them. I'm not saying that they are necessarily, again, in big quotes, because in psychiatry we are not supposed to say crazy. So they're not necessarily severely mentally ill, but there is an issue. Because there has to be a self-observant component to a human being, right?
Mhm.
So if somebody has emotional problems, that's a different story. Because people who act in a very bizarre way on the street, and believe you me, if you're not from New York, in New York, especially if you come to the bus station on 42nd Street,
The Port Authority.
Port Authority, right?
Yes.
You'll see a bunch of people like that. That's what I use. I'm pretty sure Grand Central has the same thing. So a very large number of severely mentally ill people also wind up homeless because they're unable not only to take care of themselves, but they don't even have a concept that they need help, and they have a right to refuse it in our country.
Mhm.
They tend to gather in larger cities because free services are available,
Mhm.
or at least police is not going to throw them out. Like if you go to Washington, D.C., have you ever been?
Oh, yeah.
San Francisco, have you been?
No, not San Francisco.
I've been to San Francisco. It's actually quite amazing how many homeless there are. And in New York, many years ago, pretty liberal people conducted research, and they still came up with a number of something like 80% of the homeless have severe mental illness. And you can tell something, right?
Mm-hmm.
Doesn't matter. So we are apparently talking about people like you and me who are pretty much okay, but they have anxiety. Sometimes they're depressed, right?
Mhm.
Or maybe they have crazy mood swings and periodically disappear on Mount Olympus.
Disappear. Disappear is a strong word.
Right,
I take
right.
excursions.
Right. So you're asking me to tell what the difference is between psychology and psychiatry. Right?
Yes.
Well, both of them come from, as both of the series imply to us, from a Greek word psyche, which means consciousness, right? Mental processes. And of course, it has not much to do with psychics, who you can again meet a lot of in New York City, especially in Soho.
Mm-hmm, mm-hmm. Might be an overlap between,
No.
the mentally ill people.
Yeah,
you're
so
talking about.
these studies abnormal and normal conditions of human consciousness and emotions, and one kind of developed together with another one. So everything started from actually psychiatry, the way I see it. Or if we go all the way back from even philosophy. But psychiatrists, whether they were called psychiatrists or not, did exist in many different cultures, because in many different cultures way back when, even if they weren't aware of sophisticated, complicated things like neurosis, anxiety, depression, people did have people who were severely mentally ill and, spoke to somebody who wasn't there. Let's say they thought that they were talking to the spirits. And each society had developed certain methods of how to deal with them.
Mhm.
In some cultures, the shamans would do the work, and because people felt that they are possessed, right, by spirits, and they tried to how do you call this process when you send the spirits?
Exercise?
Yeah. So exorcism. So they had different things that had to do with like removing the spirits. Even now, when you go to certain churches in the United States, like I imagine in Texas, going to the Pentecostal church where people speak in tongues.
Yo, side note, Pentecostal churches are the most lit church of all the churches. Like that,
Right.
that is the most fun time. Like,
Right. No. I'm not saying anything bad, but
oh no, I'm just
like,
saying.
for example,
objectively,
remember the Blues Brothers Part 2, right? Remember? It
We
actually
close part
started.
two?
Yeah, part
Oh,
two.
and they go to the church?
Yeah. So stuff like that. I'm not against religion at all, and
No,
I'm very
you gotta go, Dr. Schultz. I'm trying to say it's fun.
Right.
Even from like an objective, like
Right.
not religious standpoint,
Right.
like the music is banging.
right,
There'd be cute girls in there. It's like the club.
right,
And people were jumping up and down. Like, where else can grown people like do a backflip?
right.
And a man could just scream to you.
They
and then you
do black flips. You've seen it.
yes, it's like going down the aisle, like for Jesus, because the spirit of Jesus is taking over.
You've been to a place like that
I've been to all types of churches. Yeah, I've been to church my whole life.
in New York,
Um,
Pentecostal church in New York.
it wasn't Pentecostal in New York, but they used to do like faith healing stuff where like,
Right.
they let Jesus take over you,
Right.
and then you fall back on the ground,
Right.
and people just get really animated. I went
Right.
to a Pentecostal church when I was living down south though,
Right.
before,
Right.
and yeah, no, it's lit. That's all I can describe. It's fun,
Right.
and I'm not even a religious person. That's
Right.
just it's just lit there.
Yeah, but we've all seen the shamans, and you remember there used to be even a James Bond movie where they deal with the spirits.
A James Bond movie.
Yeah,
they do
with
the spirit.
Roger Moore playing James Bond, and there is
this
a
is
woman
different
who
era.
is like clairvoyant, and they had to deal. So anyway, so in many different cultures they did it. They also gave people potions, right? Like things that were made from different herbal things that also help them to calm down. I'm very familiar with Tibetan medicine and Chinese medicine and Ayurvedic medicine, and they also and this go ages like thousands and thousands of years back, and they also have things that help to calm people down. In their terminology, for example, they would say in Tibetan medicine or Chinese medicine, they have too much wind. It doesn't have to do with them thinking that you have wind in your head, not at all. It's just one of the main components, right? And it means that you are kind of anxious and nervous.
Mhm.
When people were getting super mad in the medieval ages, and even until quite recently, they were put in asylums, right? Where they were isolated, sometimes chained, right? Some methods that seem to be barbaric to us actually were helpful. Like, for example, they used to wrap people in cold sheets. Like, they would put them in cold water and wrap them. And you say, wow, this is horrible. But I can tell you that it's kind of almost made a comeback, because instead of medicating people, people tried in modern times to wrap them in cold sheets, right? And it works. They calm down.
I mean, when you're cold, I was
Right.
trying to do the most then, yeah.
And people constantly played with human psyche. So hypnosis was very prevalent in like way back when. Of course, the explosions that brought about modern psychiatry and modern psychology had to deal for psychology with a huge breakthrough when Freud came about, right? I mean, people before Freud did a lot of work, but Sigmund Freud, who lived in Vienna, Austria, at the end of the 19th century and the beginning of the 20th century, of course, made a big breakthrough because he became famous. He was very charismatic, started talking about ego, superego, id. We can talk about it some other time. But what's important is that there is this thing, ego, which is our capacity to observe what's going on. Like you and I are talking to each other right now and to the brains of the internet, and we are using our ego, right? And then medication breakthroughs. People discovered not only medications. First, electric shock came about, and it's not as barbaric as people think it is nowadays. And then lithium, right?
What makes it not barbaric?
Well, it's not. Well, before, I don't know what they did, but right now you come to the office, you meet an anesthesiologist, they put an IV in you, you go under for about 5 minutes, and the next thing you know, you woke up, and that's all. Nothing else happens that you know
Oh,
of.
they put you
But
under.
what
now.
actually
Okay.
happens is that when they hook you up to different kinds of electrodes and they monitor you, and they give electric shocks, the only thing you can see is that one of the feet but like tweaks like this, and that's about it. It's very effective, by the way, for treatment of mood disorders. And then medications came about. First Thorazine, right? Was a big breakthrough. Was discovered. I don't know. Have we ever spoken about how Thorazine was discovered?
No.
Is it interesting?
No, we should definitely talk about it because I feel like it involves people just trying different drugs.
Actually, you know what? It's kind of like a funny story. So, as many different things that are really good, it was discovered totally randomly for a totally different reason. So, what was going on after World War II? So, in World War II, general anesthesia became very prevalent everywhere but in the Soviet Union. The Soviet Union, they used in a very sophisticated way Novocaine local anesthesia. They could anesthetize the hell out of anybody. By the way, the first anesthetic, which also has to do with psychiatry, was alcohol. If you get somebody really drunk, they don't remember what the hell went on.
Mm-hmm.
The problem with alcohol is that it has a very narrow therapeutic range, meaning people pay attention. And, I'm from Russia. You can hear the accent. If anybody doesn't know, I'm Dr. Schultz. Right across from me, I have a person who chooses to call himself Hermes.
Mm-hmm.
He's from this country. So I immigrated here at my ripe age of 33 from Moscow in 1988. Of course, I know about alcohol, right? I like wine. Sometimes with my friends we drink vodka. So I'm not against it, but in moderation. But it has a very it has a very narrow therapeutic range. Meaning, when people get drunk, let's say on whiskey, right, or vodka, it doesn't matter. The difference between the stage when you are tipsy and the difference between the stage when you are out, concentration in your bloodstream is very narrow. It's very easy to overdrink.
Yeah,
and have a blackout.
I've had that issue where everything's going good until one sip later, and
Right. And of course, there are cases when people die because they have very high sensitivity, but that's a different story. So it's not a very good anesthetic. But my own father during World War II was wounded, and at that time they didn't have any anesthesia, and they needed to treat him. He was a very likable guy, and people kind of knew him. So first they got him drunk, out of his mind, did surgery on him, and then they decided to pull a prank on him. That's a real story. And when he woke up, the surgeons they still kept him on the operating table, and they started producing horrific, horrible-looking instruments, like a very big saw, a very big knife, like a very big hammer, scared the shit out of him. And then said, Jinx, I mean, everybody started laughing. So that's a real story. But if you think about civil war in the United States, like how did people get their legs amputated? Either they screamed bloody murder or they got drunk.
Yeah,
and they usually got them drunk.
Yeah.
Right. So going back to our story with Thorazine, general anesthesia came about, and people noticed that a lot of people, when they come out of anesthesia, at that time it was with ether. So you probably saw it in the movies. They would put a mask on you and then start dripping ether, which has a particular smell, and you fall asleep. Also has a very narrow therapeutic range, by the way. Some people died. Then when people would wake up, they would become violent, uncontrollably violent. It was one of the stages, and people didn't know what to do. So one of the French dentists, actually, can you believe the French, thinking about Siri?
Yes, these stuffy people.
Right. Can you ask your French Siri who discovered Thorazine?
We have to see how Thorazine's pronounced.
Yeah. Whatever, say Thorazine, and then we'll see. Okay.
Siri, qui a fait Thorazine?
Moi, Siri, j'ai été conçu par Apple en Californie.
What did he say?
He said I was made by Apple in California.
All right.
So he doesn't understand.
Let's have a competition going here. Hey Siri.
I'm here.
Who discovered Thorazine?
Okay, I found this on the web for who discovered Thorazine. Check it out.
Okay.
American Siri is killing you,
Right.
Siri guy. That being said, I don't know how to say Thorazine.
So 50 years. Okay. So it says that chlorpromazine was synthesized in December of 1951 in the laboratory of Poulenc, and I don't speak French. Became available on prescription in France in November 1952. Its effectiveness was reflected in the transformation of disturbed wards. Its commercial success stimulated the development of other psychotropic drugs. So, I mean, it's kind of like a bland story. But what happened was that one of the doctors tried to give this new substance to people, and before anesthesia,
Mhm.
and they would come out of anesthesia totally fine. And then eventually they've noticed that if you gave it to schizophrenics, even after surgery, they stayed fine. So they started using it for treatment of psychosis. And it was an enormous breakthrough. I can tell you, it's a very old medication, and you would think it's never used anymore. And if we ever talk about psychosis, I don't know how important that is for people who've never been psychotic. And I've never been myself, but seen a lot of patients. It's a big issue. It's still a pretty good medication because it calms people down. It also helps for allergies. It decreases blood pressure.
It helps allergies?
Yes.
It just does a whole bunch of different
A
unrelated things.
whole bunch of different things. And it's a very nice medication, but it's very sedating and, it has its own issues. So, and
But
then
I don't know, bro. If I'm thinking about like going on a mass murder spree, but I can also get rid of the sniffles at the same
Right.
time, it's like a 2-for-1 special. Like,
right, yes.
sounds the magic.
Well, but
no more
but,
Claritin,
yeah.
and I'm cured.
But guess what? If you are thinking about going on a killing spree, you are not going to want anybody to sedate you because you think that you are doing the right thing, right? And it's fun.
I guess.
And I
that is
cannot
true.
comment on whether everybody who committed all these horrible, heinous crimes recently with killing a bunch of people is a schizophrenic or what. I've never interviewed them. I've never read anything written by professionals about their, we call it psychological autopsy. You don't need to be dead for that, but after the event happens, people get together and discuss it.
Mhm.
We can talk about it later today even. So I don't know about that. But of course, the problem is that people who have an issue, like a Unabomber, remember? Like they don't think they are abnormal. One of the characteristics of a person who is off is that they think they are okay. Any normal person doubts themselves, right?
Mhm.
Like, I hate to say it, but I don't know anybody who would have done something. And then people tell them, what the hell is going on? And they wouldn't stop, maybe not admit it, but then go back home and think, or would do it on purpose, right? So if somebody's totally oblivious to doing horrible things, they're crazy, right? Unless they're on a mission, like Hitler was on a mission. That's a different story. But I never met the guy, so I don't know whether he was normal or not.
Mhm.
Okay, so going back to Thorazine. So then tricyclic antidepressants came about. So people started treating depression, and the major breakthrough came about with Prozac in the 80s. And if anybody is interested, there is an amazing book which is called Listening to Prozac. You might want to read it. It just talks about how Prozac was discovered. You'd be surprised to find out, I spoke about it once already, that until the mid-80s in the United States, treatment of depression would be inpatient psychotherapy for a few years every day. It's horrible. All right. So psychology was developing in parallel, right? So since I don't want to get too technical here and tell people that ancient Greeks had psychology because who the hell cares? Or maybe ancient Norwegians had it or ancient Russians, because we don't have access to this. So even if in ancient Egypt there were psychologists and psychiatrists, it doesn't do anything good to us because these civilizations were lost and rediscovered, right? So in recent history, since the times of Freud and Jung, who used to be friends, and then in 7 years they like weren't friends anymore.
Biggie and Tupac.
Yeah. Right. But psychology has been developing massively, and now is a massive field of science, medicine, research. So a psychiatrist, coming back to your original question, in the modern world, in the United States, is mostly a person who prescribes, diagnoses illness and prescribes medication. A psychologist is a person who conducts psychotherapy using different approaches, does not prescribe medications. And I hope they never will, because they don't get education in this.
Mm-hmm.
Can a psychiatrist, and this is going to become very unfair right now, do psychotherapy? Yes. Like, for example, I'm trained in psychotherapy. I specialized in brief adaptive psychotherapy, which I love. I choose not to do it, but I can. A psychologist cannot prescribe medication.
Why do you choose not to do it? Because it sounds like something that took a lot of work to do for you to just be like, you know what, I'm just not going to do this ever.
Well, my life is in the particular stage right now when, as you know very well, I'm actually trying to create a new field of medicine, brain technology. I know it sounds extremely, I don't even know how to say, like kind of crazy, like I'm full of myself, like I'm almost manic. I'm thinking, no, it's,
You say casually, I'm going to make a new field of science.
No, but it's required, and we have an episode. Guys and gals and everybody else, you guys can go back and check out our episode about it. I think we did it with Master McMaster, not you, right?
Probably.
But so I'm more interested in things like quantitative EEG, neurobiofeedback. I do prescribe medication. I'm thinking about probably beginning to do some psychotherapy, actually, as early as next week. Seriously.
So you're bringing it back full circle.
Yeah. But a lot of my colleagues of mine don't. I have to say, and again, you can think it's horrible, disgusting, but insurance also doesn't pay enough for a psychiatrist to do psychotherapy exclusively. I'm planning to go back to do it, taking insurance, actually, at least in the beginning. But I chose to prescribe medication. A lot of colleagues of mine and some people I know closely have cash-only practices in New York, where they see a patient every single time for an hour, and it's a combination of whatever they need. So they might do psychotherapy for 45 minutes and then talk a little bit about medication. But the majority of people who you guys are going to wind up seeing for insurance, we can easily divide in two categories. Psychiatrists, who are all either MDs, medical doctors like myself, or we have psychiatric nurse practitioners. Psychiatric nurse practitioners went to school for a shorter period of time, had a different type of training, but they are licensed and they are capable of prescribing medication. They also can do psychotherapy. I don't know how much training they get. And if you are interested, if Hermes asks me what you need to check for, I'll tell you.
Yes. What do you need to check for? I'm just trying to go to anybody and just, get messed up.
Why don't I talk a little bit about psychologists, and then I'll say what we need to go for. So psychologists also have different types of training. We need to understand that there is a long way, like, for example, getting a PhD. If you want to get a PhD, you graduate college first. So you did for 4 years. Let's say you majored in psychology. Then you go, pay attention, to either 7 years of the PhD program, which is very competitive.
So prison sentence
7
of education, yes.
People who do PhD programs, they get paid a stipend, but it's very small, and it's a very big commitment, and you do a lot of research. Or you can get a master's degree, which is 3 years. It's going to be significantly more like you are not going to be a PhD, right? It's like a nurse practitioner and an MD. Let's not play games here, and let's be honest with each other, right? MDs have more respect. Whether it's, I met nurse practitioners that are much better than a bunch of psychiatrists I met. And I met a bunch of psychiatrists who are totally dumb, right? And if it applies to me, it's fine. But it's just a title. But still, people on the street, right, prefer to see an MD, correct?
Yeah, that's generally how it works. Yeah.
Unless they are control freaks and they want to manipulate somebody, and then they might think that a nurse practitioner would be easier. No, it's not going to be easier. All right. So you can have master's degree in psychology. You can have a PhD of psychology. And then a lot of people choose a shortcut. They get social work degree, and then they can be a licensed, certified social worker, and they can be masters of social work, and they still get reimbursed in some cases by some insurances. I refer people outside to, if not in my practice, to 2 psychologists, one of whom is a PhD, another one is a social worker, but she's very good, right? Because, for example, if somebody decides to get training in cognitive behavioral therapy, they can go get training on the side. and they're going to be as good as anybody else.
Mhm.
Or somebody decides to do psychoanalysis. In New York, we have 2 psychoanalytical institutes. So if a social worker gets trained there, and a PhD never got trained in psychoanalysis, or me, I'm not trained in psychoanalysis.
Mm.
What good are we going to be?
It's
Right?
like there's just a whole bunch of things to
Right.
specialize in.
A few questions you might want to ask.
It's just like the main thing is with all these different specializations and things that you have, what exactly makes a good psychologist or psychiatrist? Like what traits would you say if you're just, Sally walking down the street, walks into your psychiatrist's office for the first time?
Right.
There's a limited amount of skills and different ways to treat you or even analyze your situation. Like as a patient, what should I be looking out for? Like,
Well,
what
I'll
makes-
tell you. So if you have an opportunity to get a referral from a friend of yours, that's the best place to start. If you're just looking around, no matter how much I hate the system as a doctor, currently people go on ZocDoc, right?
Mhm.
Which is an app that allows you to read reviews. And if you ask me, I'll be very happy to go forever about how these reviews are written. And please ask me because I have.
It's like Yelp for
Yeah.
doctors.
On Yelp, also, you can find the doctor, and you can go on Google, even find reviews. And then there are tons of things. So you have to be careful about it. And please ask me later, and I'll say why I say it. Let's say you found somebody. Like you saw that Dr. Schultz, I used to have 4.5, which my understanding is kind of normal because if I had 5, it's fake. That's what people tell me, right? Since I am closing this office in which we are sitting right now, my reviews went down by 0.1 point because people are upset with the front desk, they're upset with me, whatever, doesn't matter. So 4.4, 4.5, then you walk in and you meet someone and this person is so wrong. Like the moment the person walks towards you, it's not like there is no chemistry, you really want to leave. Has it ever happened to you that you meet a person, like let's say you go on Tinder and then you go meet and you like all you think about is to escape?
Tell one of my trashy Tinder stories. Yes, I've met terrible human beings.
No,
and
but
been
that
stuck at the
doesn't
table.
even mean to be terrible. So I'll tell you, for example, a new professor comes to teach you and the person walks in and you either immediately click for the reason you don't understand or you don't, right? And it's not because you are psychic. Our brain constantly processes everything. Smell, how the person walks might remind you certain childhood memories that were pleasant, unpleasant. We are very sophisticated, right? So if you meet a doctor, whether it's a psychiatrist or a psychologist, and you don't want to deal with them from the moment you saw them, you need to tell them, sorry, I made a mistake, but I don't want to continue. If you can find it in yourself. Because I don't know whether people say it in the United States, but in Russia, I've heard all the time, oh, he's a total asshole, but he's a good surgeon.
Mm.
Have you ever heard that?
Yes.
All right. This is not true. One cannot be a good surgeon for you if you consider this person to be not nice and don't want to deal with them. Nothing good is going to come out of this relationship. You need to be comfortable going under.
You have to like your psychologist or psychiatrist.
You have to like them and respect them on a human level. Your first impression is extremely important. I can tell you more. Research was done, as if it wasn't obvious, to see what is the main defining factor of success in psychotherapy. Do you know what it is?
Is it being likable?
Yeah. No, is it whether or not you get along with your psychotherapist and like them and respect them? It's not the skill set even. Okay?
It's a person-to-person thing then.
Person-to-person thing.
Yeah.
Okay. Then, I don't know how much experience you have, but, it's going to sound very kind of like common what I'm going to say because people talk about it all the time. Let's imagine you called a plumber.
Mm-hmm.
And the plumber comes in. How soon are you going to be able to tell whether he knows what he's doing or not?
You could probably give it like 10 minutes, if that.
Yeah. Right?
Because
right.
Is he just playing around with the toilet?
Right.
Is he just like flipping crap over? Does he look like me when I open up my toilet because it's like a maze?
Okay. So if you go and see any doctor, psychiatrist, psychologist, and you are beginning to feel that you are dealing with a highly professional person, And whatever it takes for you, maybe you see nice diplomas. I have tons of diplomas. I don't even display probably even like 20% of
You
them.
don't flex on them?
No,
You have
I
to
don't.
you have to show off. Wait, what is
No.
what do you-
We can talk about me, but it's not important at this point. But you can feel, right? You can feel the pro. And if you don't feel it, the person is too young for you, right? Has a horrible accent that you cannot understand. I seriously, like, I'm talking on a podcast right now, right? But I'm hoping the brains of the internet understand me. But I met a bunch of people who cannot understand me. Do you understand me?
I understand you very well. Yeah, I think Americans generally have just very
You would be
deep
very-
stupidity in them.
No, you'd be very surprised. I mean, I met a number of people, not even my patients, who completely cannot understand me. So
Do they speak English well? It's like
no, I don't ask them. I don't ask them. I tell them. No, I tell them. I tell them you don't understand me, right? And they say, "Well, your accent, blah blah." So don't see anybody or if somebody has an accent that irritates you, whatever is wrong.
Their voice is just
Right.
annoying.
So you know how we say, don't judge people, everybody is equal. Well, I don't know about that. When it comes to your doctor, you need to be comfortable.
Mhm.
Everything has to work for you. The waiting area has to work for you, right? Okay.
Mhm.
So we got that.
So judge your
Not
psychologist.
judge.
or
Listen, not
psychiatrist.
judge. You have to screen the situation. And if you are uncomfortable in the situation, get out.
Treat your psychologist or psychiatrist like a hot date,
Yes.
basically, where you analyze everything and you're ready to leave the table at any time.
Right.
Copy.
So if you decided to stay, it's a very good sign.
Okay.
So, but people nowadays are not that simple. At least where you and I are sitting right now, in Tribeca, in New York.
Go ahead. That's a flex.
Right.
Yeah,
People
sure.
do what they call research. I put it in huge quotes and hate to say it because it's not research, right? Research has certain conditions. I mean, people go on the internet, mostly Google, and just Google the hell out of everything and everybody.
Mhm.
So let's say you are coming in and you have a set of questions.
Mhm.
Let's say you are coming to see a psychiatrist and you have on your mind what medications you would like to try. You need to allow a person to, like, if you decided that this person is okay, let them talk to you. Let them get to know you. In the process, you'll know them a little bit. And then if you feel comfortable with the person, and by the end of the interview, I'm talking about the first meeting, you still feel that you would like to hear their opinion,
Mhm.
as their opinion. I'm telling you right off the bat as a doctor, if you are looking for somebody who is going to automatically give you your Lexapro or your Adderall or whatever you came for, you are not going to get a good rapport with a sophisticated physician.
Mhm.
A sophisticated, smooth psychiatrist, of course, is not going to be direct, right?
Mhm.
I'm guessing I'm not that smooth because I'm very direct when it comes to that. I usually let people take a look, and then 1+ minute of the episode where my spiritual leader, Jackie Chan.
Jackie Chan.
Well, Jackie Chan plays in one of the movies an Wushu master, martial arts, master who talks to a very young boy from the United States who comes in and tells him, so why don't you teach me this move and that move and this move? And they're drinking tea. So Jackie Chan's character keeps pouring in the cup and it starts burning the hand and says it's burning. He says, yes, you need to empty your cup, right? Like meaning don't come to me telling me what to do, right?
And
This
this
kind
is your inspiration in
My
your,
inspiration
in your
because-
psychiatry work.
Right,
It's to burn hands.
No. My idea is that when you come to a pro, if you decide it in the process, it's a pro, give them a chance to give you their opinion
Mhm.
before you start shooting at them your, names of the medications. They'll ask you. They'll ask you.
Mhm.
All right. So when it comes to psychology, maybe you already know that you are looking for cognitive behavioral therapy. A good book to read about CBT, cognitive behavioral therapy, is Feeling Good. It's a bright yellow book. It's between $5 to $6 on Amazon.com. And I highly recommend before you decide. And it's written by the guy who is still alive and very famous. So you might decide to read whether you want to, because CBT is very popular right now. If you want to have Freudian therapy, why don't you discuss with your psychotherapist your issues and what you are looking for.
And
So when you-
your mom relationship, like your mom love or dad love?
Well,
I feel like everything Freudian is just some kind of
no,
weird, like,
no. It's actually
I love my mom more.
No.
than everybody else.
It's significantly more sophisticated than that. But they're like speaking about French. In France, a very popular movement is Lacan. It's a very interesting psychologist, and a lot of people in France follow his steps. There's also couples therapy, right? So then it would be Salvatore Minuchin, who brought it to the United States. He's from Mexico originally, still alive.
Really?
Yeah.
From Mexico, couples therapy.
Mexico couples therapy.
That's where it
yeah.
comes from.
Yeah, Salvatore Minuchin. He's old. Yeah. So there are many, many different types. So you need to decide, first of all, honestly, whether you are going to be comfortable seeing a social worker. If this is a barrier for you, don't even go, right? Because if you are going to be looking down at the person, it's not going to work out. Right?
Yeah, it sounds like you should be willing to do something if you're going to choose to do it.
But also with a person you chose to do it with.
Mm-hmm.
And guess what? If you didn't have any issues and knew how to fix them, you would be sitting in front of them. So maybe they know. At least let's give them an opportunity. Again, I'm going to stress again and again. If you don't like the person, if by the end of your interaction with this person, you didn't feel that you got out of this interaction what you wanted to, there is absolutely no reason, I'm sorry to say it, and it's only my opinion, and of course I'm very opinionated, don't give them a second chance. It's useless. It's going to irritate the hell out of you. It's going to irritate the hell out of the provider. What else would you like to know?
So you went on your hot date with your psychiatrist,
Right.
right? You're like, okay, I think this could be popping. Like, I
Right.
think we can have a good run together. From there, it's like, how are you finding medications? Like, you said don't come with your medication list, right?
No, you can come with your medication list, but give them a chance to offer you something.
Okay, so really the biggest thing is, as a patient who's not an expert on any of these things, like, how do you find new medications? How am I supposed to find new medications? Like, if I came through your door and like, no, I like this Prozac stuff, it sounds
Right.
poppin', I might have had it or not had it before.
Right.
What is the best way to go about like introducing the new pill that I could be putting in my life? Or maybe it's no pill at all, or maybe it's just a
Right.
different type of
So
therapy.
first of all, I can tell you that in my opinion, a good doctor is not the doctor who knows how to prescribe, although it's very important. A good doctor is a doctor who knows when not to prescribe. And I can't even begin to tell you in how many cases, it's not like 100% of cases, I tell people that they don't need medication, or I want to do medical workup, meaning see whether there is any physical issue going on, especially when it comes to attention, anxiety, sometimes depression. But let's say we came to the point when we are discussing medication. I would like to quote a saying from a very wise person who 2,000 years ago said. He said, if there is more than one answer to a question, it means there is no answer. Right? Where should I go? Left or right? Left, right. Guess what? We have over 20 probably antidepressants. We have tons of mood stabilizers. And it's very difficult to pinpoint what this particular person needs. So each psychiatrist, based on years of experience, knows very well a few medications better than others, and will be able to explain, ought to be able to explain to a person what choices they make and why they suggest to take this medication. So if somebody with a Russian accent tells you, just take the Prozac, doesn't sound like Russian accent. I try to like
Your Russian accent, is actually terrible.
But I said Prozac. So we will see. Take Prozac and go away. Like this is not good, right? They ought to be able to explain to you what the choices are, why the choice was made. I can give you an example. When I talk to a young male or female, I really don't want them to gain weight. I really don't want them to use this to lose the sex drive. I don't want them to use an ability to achieve orgasms. And I don't want them to feel like a zombie. Is it fair?
I mean, that sounds all terrible.
Right.
Yeah, so,
Okay.
sounds fair.
Okay. So we are going to have a conversation about that. why do I make a choice like that? Like, why do I suggest for them to take it? It becomes more complicated because not everybody has unipolar depression. Somebody is bipolar. Somebody has anxiety. Some people are afraid to take Xanax and stuff. So we are going to talk about history, how it was discovered. So I have a tendency, and I'm not here to sell me as your potential doctor, right? Don't worry about it. I'm just telling you that there needs to be a conversation when a person has an ample time to ask questions, and a real pro, would have no problems answering them. But then they have to arrive to a common ground. Is there anything to help us nowadays? Yes, there is saliva genetic testing. Many different companies provide it, which allows to see how our liver enzymes process a particular drug. So if you want to shell out somewhere in the neighborhood of $350, regardless of what insurance you have, right?
It's just not covered.
It's not covered unless you have Medicaid or Medicare that is covered 100%. You can have this test done. It's once a lifetime test. And again, there are different companies, so I'm not going to give anybody an edge here. And they send you a printout after a doctor takes a swab of from your cheek and sends this away. It's not like 23andMe where you have to spit until you die. Like you have to spit the whole large container.
You sound traumatized over there.
Yeah. No, this is very easy. And they show the doctor and you what medications are most likely to create problems with digesting them by your liver. Does it mean that you don't have to take them? No, it probably means that you have to take less of it to get the same result. Again, there has to be conversation. So, especially one of the companies claims that it certainly helps to improve the way we treat people. It's not a bad idea to have them done. But it's still based in my experience when I suggest certain things. So then some people come less and less and say, so you're going to conduct an experiment on me. I'll be your guinea pig. Absolutely not. All the medications that we use in the United States have been approved by the FDA. It's a very painstaking process, takes years and years for medication to be approved. But we need to give the medication and see what's going to happen.
Mm-hmm.
There is no way for us to know right away, right?
Yeah, you have to do
Also, of course, we all want to give one medication only. But statistically, less than 30% of people with depression even respond to a single medication. So the chances are that do I have people who respond immediately to a particular medication I give them right away? Of course, otherwise I wouldn't be doing what I'm doing because statistically it's good enough for people to keep coming back to me.
Mm-hmm.
But do I and everybody else I know have patients in whom we still cannot find a proper medication or a combination of them? Yes. So it's a process, and there is no other way but for me to listen to your story, do some screening tests if I need to, and then have a discussion with you on what I think is the best choice. And then we discussed this issue with Master McMaster before, and we spoke about side effects, and she said that in her particular case, she didn't care much about minor side effects. So what is good for her might be horrible for somebody else. Right?
Everybody's different.
Yes. And when it comes to psychologists, again, you have to see what works for you.
Copy. Try them on. Try them on like hats. Kid.
Right. Why don't you ask me about ZocDoc?
I mean, you were half trashing it when you brought it up earlier. Like you said ZocDoc, and you're like, but it's not the best thing. And then you
I can tell you that ZocDoc, of course, has a value and helped to develop my practice very fast. The problem with and it's not only ZocDoc, it's any other system. It's not even a problem. So what is considered to be a fair thing to do is that anybody can write anything they feel like. I had a discussion, for example, once when a client came to see one of my nurse practitioners, whose score actually wound up being a perfect 5.0, and it's an honest score. And I know what happened, right? The person came for a wrong reason, wanted what shouldn't be done, wanted medications that no sane person would give to this particular guy. I don't want to reveal too much.
Mm-hmm.
and decided to trash her on ZocDoc. So wrote that it was a shabby office, and you've seen my office, it's kind of beautiful, and that he was sitting in a folding chair in a nasty looking room. We don't even have folding chairs.
I don't see one.
So
shit in it.
she got very upset with this review. He gave her like a 1 star. And I called ZocDoc. They have special people to talk to me. And you know what they told me? That yes, they saw pictures of my office that they placed on their website. But still, a person has a right to have their own perception. So that pisses me off, right? And I've had cases when people came here and created a total mess by cursing at my staff and then writing terrible reviews about them. And so all my staff feels that I ought to be able to respond. My answer is no. I don't want to respond.
You don't respond on ZocDoc?
No, I can tell you why. No, you can't.
Oh, you're not.
You can respond on Google, but I don't. And I can tell you why. Because it's not because I agree with them, but because it's my patient, it's my client, and I don't want to reveal anything about our relationship. If somebody comes here and wants me to prescribe, I don't know, Xanax, and I know that they are doing drugs, or, I mean, I don't treat people with drug addiction at this office. I would like to help, but that's not what I do here. And then they get pissed that I told them that I don't do it, although it says all over the place on ZocDoc. I'm not going to strike back at them because I'm a doctor, right? I'm not a professional killer. I'm not special ops going like black ops mission. I'm a doctor. So I'm not going to hurt them. But I would like for people to understand that if they cannot develop a dialogue with a professional, there is no reason to continue. Does it make sense?
You have to have a conversation.
Right.
It starts with that. It's not like you just go to your robot. Maybe in like 50 years when Google designs your personal psychologist, then you can just talk to a robot and be like, give me this.
It's actually significantly more sophisticated than this because right now there is already a conversation of this kind.
To get a robot to treat you?
No. Google collects information on us all the time. And I have nothing against Google, Microsoft, whoever. It doesn't really matter. Facebook. We can come to the point when these systems have so much information on each one of us that they can give us a very educated advice on what medication we need to take. Like, for example, people talk about the fact that if, let's say, Google had access to texts and emails that people send when the epidemic of the flu begins, Google would be able to pick up on very subtle things that people communicate to each other and announce that there is an epidemic once it hits the point. Whereas right now, a bunch of people have to come to a bunch of doctors, tell them what's going on. Hermes is shaking his head.
That's terrifying. No.
It is terrifying.
I'm just listening.
No,
to
but
it.
it is coming to us. So it's not like there's going to be a robot who tells you what to do. Siri will tell you what to do. Or Cortana. Or what's the name of this lady from Amazon?
Alexa?
Alexa. Yeah, it's possible.
We gotta get rid of Alexa, bro.
Well.
Hopefully, in 50 years, she'll be gone, bro.
Oh, I actually have a lot of friends who are professional computer people. They call themselves computer engineers. Remember, like this guy? And they have Alexas because they don't care.
She's too much. Too much. Amazon sells me too much stuff for her to talk to me and be the same people.
Yeah.
Like, no.
So I would like to be clear before we stop. It's a process. I don't have a magic pill for every single condition. I do, for example, I advise people on supplements, but again, I don't think that you can eat your way out of depression. I don't think you can eat your way out of anxiety. It's too complex, right? And yes, if there is good food for the brain, and I kind of have joke, but Punkmaster and I used to joke that pizza. Do you like pizza?
I'm a New Yorker, yeah. Love pizza.
What's your favorite pizza place?
My favorite pizza spot? The spot I go to most often is in Brooklyn and Crown Heights on North
Right.
Drive.
Yeah.
Tony's on Nordstrom.
I prefer Howard Beach, but what do I know?
Howard Beach?
Oh, yeah. Definitely.
You need the Russian flavor on top of the pizza.
No, Howard Beach is not Russian. It's Italian.
Oh, is it?
Howard Beach, not Brighton Beach. Howard Beach.
Oh, I thought there were Russians out there.
No,
Howard Beach too.
well, whatever. Yeah. So anyway, brain likes carbs. 20% of glucose consumed by our body is consumed by the brain. So I don't suggest that you start drinking sweet soda. It's not good for you. or like Gatorade. But even if you eat in a very sophisticated way, and even if you take the supplements, if you are clinically depressed, you need to do something about it more than just the supplements, right?
Talk to somebody, people.
And people, and people who are depressed make wrong decisions very frequently. Okay,
Also
so on
drunk
this
people,
positive note, I would like to suggest to people, please keep your brains wide open.
And we'll see you next time. And also stop using Alexa, everybody. Stop it.
No.
Using Alexa is like dating like your boss's daughter. Like there's just too much conflict of interest. You break up with her, you're going to lose your job. And then your boss knows everything.
Well, listen, my thing is that when you come to the train and you enter the train, take off your backpack. Okay?
Yes.
You
actually,
agree?
Don't be. That's more essential to health, mental health and everything.
All
Take
right.
off your backpack.
Take care, guys. Bye.
Peace. Yeah. Thanks for tuning in to another episode of Brainstorm 9000. If you like us, love us, or marginally tolerate us,
And definitely, if you hate us,
then go on social media and give us a review on Stitcher, iTunes, or YouTube, or wherever you listen to us.
and remember, keep your brains open.